Good day, students, and I want you to keep safe, and I hope that soon this pandemic will be over and we'll be all back together again soon. All right. Today, I'm going to talk to you about the arteries and nerves of the pelvis. Now, in the specimens, there aren't too many of them that you'll see. And those are the ones you tend to get asked on in the exams. So I'll tell you the ones that are easily seen, but I'll be showing you all the branches of the arteries and the nerves. Remember that there is a false pelvis and a true pelvis. When we talk about the pelvic cavity, we're talking about everything inside this pelvic brim. Pelvic brim consists of the pubic crest right here, or you can say the pubic symphysis, this pubic crest. Then we go into this sharp line here. You can see the sharp line right here, right? That's the pectineal line. And we move on to the ileum, and we see the arcuate line of the ileum here. The pectineal line comes all the way up to here, right? And then this is the arcuate line of the ileum. Sometimes this line and the arcuate line and the pectineal line is referred to as the iliopectineal line. Then we move on to the sacrum. And everybody knows that this part is the promontory of the sacrum, and this is the ala of the sacrum. So what forms the pelvic brim is the pubic crest, the pectineal line, right, the arcuate line of the ileum, the ala of the sacrum, and the promontory of the sacrum. Now, this is not a day I'm going to talk about bones. I'm just going to tell you about the inlet. I'm going to point out this very important point in here, right? Well, I'll turn it over in a while. I want to show you that this is L5 here, and this is L4, right over here. Because one of the arteries we meet today, the common iliac, is going to start right at the L4 level, whereby the common iliac vein is going to begin at the L5 level. So I'll show you another part of the pelvis. This is just for your information. You would have known all this already. Remember that this is the anterior superior iliac spine, and the widest part of the pelvis is the tubercle of the iliac crest, right here. And if you look, it's the most lateral part of the pelvis. So it's about 5 centimeters behind the anterior superior iliac spine. If we take a position, a transverse line between those two iliac, those two tubercles, this one and the other one over here, that goes through L5. Right? L5 will take you right through there. Right? At this point. This is where it is. You can actually feel it on yourself. If you feel your anterior superior iliac spine, you just go back and you feel this area. So this is called the intertubercular plane at L5. And that's where the common iliac vein is going to begin. Then, and that will be more to the right of the midline. So these vertebral bodies belong to the abdominal aorta and the inferior vena cava. Inferior vena cava is going to start right at the same point that the common iliac veins are going to come off. That's L5 for the transtubercular plane or intertubercular plane. Now, come to the aorta, the abdominal aorta. That's going to run down on the lateral aspect of the vertebral bodies. I'll show them to you in a little while. And that is going to get to L4, right about this point, when it's going to divide into a right common iliac artery and a left common iliac artery. Right? So I'm going to just go to a specimen and then come back to this a little later. So I have the specimen here. So if I were to show you, this is the abdominal aorta here. As I told you, it's on the anterior, right, and this is the IVC. Right, so this would be on the left anterior aspect, the aorta of the lumbar vertebrae, whereby the IVC is on the right anterior border. Now, the abdominal aorta is going to end here at the L4 level. Now, I should have showed you that also. L4 level is right here. Now, the highest point on the pubic crest is called the supracrystal plane. Right, the supracrystal plane. That's between the highest point here and the highest point here. Right, and then the back, right here, that's going to go through L4. Right, L4 vertebra. That's the anesthetists use that plane a lot when they're trying to do a lumbar puncture or lumbar tap. Because you know from neuro, they don't want to go anywhere up to L1 or L2. You can damage the spinal cord. So this plane, the supracrystal plane, is at L4. So when we say that the aorta ends at L4, it ends on the supracrystal plane. Now let's take a look and see what's going to happen to them. Right? So here we can see where the aorta ends. Right at this point, we have the right common iliac artery and the left common iliac artery. If we go almost a vertebral body down from here to here, right, this is where the IVC starts, because remember the blood is going up, or you can say the IVC ends, whichever, but this is where I would say the venous blood is going that way. So this is the right common iliac vein, right, okay, and this here, which is much longer, because it's come from the left side, to get over there, is the left common iliac vein, this one, right? The right common iliac vein, the left common iliac vein. If we look here, we see where the left common iliac vein is going to join the right common iliac vein posterior to the right common iliac artery. Right? Right, very, very important. Right? Left common iliac vein is going to be longer. It's going to go right across the pelvis there to the anterior aspect of L5, where it's going to join the right common iliac vein. The left common iliac vein is longer. Right? Now, as they are going into the pelvis now, so this is right at in front of L5 and L5 and L4. They are now going into the pelvis. So this division of the right common iliac artery into the external iliac artery, which is this one, right, and the internal iliac artery, which is this one, right, okay, it's happening in front of the sacroiliac joint, right at this point, in front of the sacroiliac joint, right, That's where they're going to happen. So the common iliac artery is going to run this way. At this point, it's going to split into the left common iliac artery, into the left internal iliac artery, which is going to run down in the pelvis, and it's going to continue along here, right, as the external iliac artery. Similarly, on the right side, the right common iliac artery is going to divide in front of the sacroiliac joint, where the internal is going to run down into the pelvis, and the external is going to go to become the femoral artery. Alright, so that's just what I wanted to show you. Right? Now you have to remember the arrangements. And it's easy to remember the relations. If you start from the femoral triangle, remember that the femoral vein is medial to the femoral artery. So the external iliac artery is lateral to the external iliac vein, and that's how they're going to run. Right? This is the external iliac artery here, external iliac artery, and this is the internal, and this is the external iliac vein. So they are running. These are going to be running medial to the artery. Similar here. This is the external iliac vein on the right. Is going to be running medial, more posterior medial to the artery. At this point now, when the veins join, the left common iliac vein is going to pass, right, which is still posterior medial at this point, but it's now going to go behind the right common iliac artery to become the inferior vena cava by joining out the right common iliac vein. Alright? So, and I always like to show diagrams. You know I like to show my diagrams. So here we have, right, okay, on the right side, we can see, I can go down this one for me. Okay, on the right side, okay, better, yeah. We can see the division of the aorta into the right and left common iliac arteries, and then the right common iliac artery is going to divide into the external iliac artery and the internal iliac artery. They're going to run down, these are going to run down into the pelvis. So really we're not going to deal with anything up in this area above the pelvic pyramid. Just showing you how the things get in there. We're going to deal with the vessels that are in the pelvis and the nerves that are in the pelvis. Alright? So, right in front, anterior to the sacroiliac joints, that's where the internal iliac artery is going to descend into the pelvis. And you can see the relation here where things are medial, the veins are more posterior medial to the arteries. But as we get to where the inferior vena cava starts, they're going to pass behind the right common iliac artery. And this is the L5 level, and this is L4 level. This is the sacroiliac joint. Now let's just take an artery. As it descends, right, take an internal iliac artery. This is the left side. As it descends into the pelvis, right, remember it's extraperitoneal at that point. As it descends into the pelvis, so you're not really seeing much of it when you look down in the pelvis, right, until you start dissecting. It's going to divide into a short posterior trunk and a long anterior trunk. A short posterior trunk and a long anterior trunk. Both sides is the same. Right, but this is just the left side I'm showing you here. Of the short posterior trunk, is going to come 3 arteries. How do you remember the names? The one that comes up back out of the pelvis is called the iliolumbar artery. The one that goes down inside the sacrum is the lateral sacral artery. And the one, we haven't done the sacral plexus as yet. I have it dissected out there for you. But you're going to see the one that goes through between the lumbosacral trunk and the S1 nerve of the sacral plexus. That is the one you've met before, and that is the superior gluteal artery. Superior gluteal artery. Alright, so how do you remember them? Iliolumbar, lateral sacral, and superior gluteal. So I call them ISS, International Space Station. Right? Iliolumbar is very important artery. As it comes up, right, it's going to run over the lumbosacral trunk, which is coming down here, and I'm going to show you all those things, right, okay? And it's going to run behind the psoas muscle, right, well on this side, this is the left side, it's going to run behind the left psoas muscle, which is here. Just when it gets behind the left psoas, it divides into an iliac branch and a lumbar branch. The lumbar branch is really the 5th lumbar artery. So from the aorta, you know, abdominal aorta, you know, there are 4 lumbars. Well, there's a 5th lumbar, but it's really not coming from the abdominal aorta. It's the lumbar branch of the iliolumbar. That's going to supply psoas, quadratus lumborum, all the things on the posterior abdominal wall. Meanwhile, the iliac branch is going to run down along the pelvic brim. You're not seeing it here. Deeper. And then that's going to go all the way to the anterior superior iliac spine. And there's an anastomosis of vessels there, which you can read up about. Alright? You remember the superior gluteal. Everybody should remember that the 3 exit points from the pelvis, right? So this is the ischial spine here, this is the ischial tuberosity. This is the ischial spine, this is the ischial tuberosity, right here. So, the massive ligament here comes from the sacrum to the ischial tuberosity, and that's a sacrotuberous ligament. Also, I want you just to recall the greater sciatic notch and the lesser sciatic notch. The greater sciatic notch and the lesser sciatic notch. Alright? Well, the sacrotuberous ligament comes down to the ischial tuberosity right here. Part of it, right, is attached along this crest right here, and that's called the falciform part. And the sacrospinous ligament goes to the ischial spine. And they're going to convert these 2 notches into 2 foramina. Well, this is nothing new to you. This is basic stuff from locomotor, right? So this is the greater sciatic foramen, the lesser sciatic foramen. Meanwhile, this is the obturator foramen and the obturator membrane. Right at the top here, we have the obturator foramen. So these are the 3 means by which vessels are going to get out of the pelvis to go to the gluteal region, right? Okay, and mainly to the gluteal region here, right? Okay, and then some are going to go out here and come back this way to supply the perineum. That's it, and that's the internal pudendal artery, which I'm going to show you. All right. Now, how are we going to remember all these branches now? I have a dissection of a female pelvis that looks just like this one, but not these nice dissection of the arteries. These are very time consuming, and this one is copied. All right, okay? But you don't get to see them. It don't matter how good you are, you'll spend a lot of time trying to find these vessels. So these are the three. This is an actual picture of a dissected specimen. And you guys are lucky, because what's going to come in the exams is pictures of dissected specimens. These. So I think they're better than some of the specimens we have here. Okay. So here's the iliolumbar going right up. This one here is the lateral sacral. Right, I'm not too certain what it is, but that's not a very important vessel there. It looks more like a vein to me. You know, this is the lateral sacral, and this is this big one here, which is going to go through. Remember this muscle? Everybody remembers that muscle? That's the piriformis. Remember? Piriformis arises lateral to the anterior sacral foramina 2, 3, and 4. Right along here. It's going to go through the greater sciatic foramen to be attached to the intertrochanteric crest on the femur. Right? Well, really, to the lesser trochanter at the upper end of the intertrochanteric crest. Right? So that piriformis is a landmark for the greater sciatic foramen. But I'm not going to go back there. That's gluteal region. Alright, okay? We're going to deal with the pelvis. Alright? So the posterior division has 3 parietal branches. The iliolumbar, lateral sacral, right, okay? This one has the lateral sacral, right? And the massive superior gluteal. Now the lateral sacral is best seen on this one. The lateral sacral runs down over the sacral plexus, which is coming out through the anterior foramina of the sacrum, and that is going to supply, right, those nerve roots that are in the sacral canal, right, and the piriformis muscle here, segmentally. So we can think of the lateral sacral as being segmental. So we have L1, 2, 3, 4. Then we have the lumbar branch of the iliolumbar, which is L5, and this is now the lateral sacral providing segmental supply to the body wall. All right. Now we come to anterior division. So that's easy. Anterior division is I'm going to show you an actual picture. Right? How I remember it is this. I remember it in the female, then I compare it to the male. It has 9 branches. Right? And this is how I remember them. 3 branches go to the bladder. 3 branches, and we're talking about anterior division in the female. We have to make some adjustment when it comes to the male. Anterior division in the female has 3 branches going to the bladder. And you say, what is Dr. Francis talking about? Because there's only 2 branches I know that go to the bladder. But remember that this here is the superior vesicle going to the bladder. But the superior vesicle is coming from the patent part of the fetal umbilical artery. I wish I had some students here to ask these questions. But this part is obliterated. So one of the vessels here is really the obliterated umbilical artery. Alright, so once you see this, you can see the superior vesicle there. Alright, what you see here is the ureter coming down. Alright, then we're going to come to the superior vesicle. We're going to come to then we're going to come to two very important arteries. Alright, okay? Well, first of all, this big one here, right, is the obturator artery. Alright? So let me just go back. 3 branches to the bladder. Superior vesicle, inferior vesicle, obliterated umbilical artery. Then we have 3 branches to viscera in the female. One is the uterine artery, one is the vaginal artery, and one is the middle-rectal artery. Go over them again. Uterine artery, vaginal artery, and middle-rectal artery. You can see the middle-rectal going down here to the rectum. Right? A lot of these arteries sometimes come off as one and then divide. Right? Okay? So what we really have here is this is the uterine artery and this is the vaginal artery. Yeah? Right, okay? And I'm going to show you the uterine artery. You have to know the uterine artery because as it comes off, so that's what. One of the easiest ones to recognize is this big one. Right? The obturator artery, which is going to the obturator foramen on the lateral wall of the pelvis. Then we have the uterine artery, which is going to cross, it's coming from the lateral wall of the pelvis, and it's going to cross in the broad ligament, in the lower part of the broad ligament called the cardinal ligament, right, okay? And it's going to cross the ureter anteriorly. Always remember that relationship. The uterine artery is crossing. Nobody's going to show you a diagram like this. Nobody's going to ask you all these things. I'm going to show you some branches that we can see in specimens. Alright? Vaginal artery is going to the vagina. What you really have here is this one is really an inferior vesicle and a middle rectal coming off together. Alright? Now, still on the anterior division here now. We have 3 parietal branches. Alright? So what are the 3 vesical branches? Uterine, right? Ovarian, and middle rectal. Then we have 3 parietal branches now, which is this big one, the obturator. Alright, remember that the obturator is going to go through the obturator foramen to supply the thigh. Alright? And we have this one here, which is the inferior gluteal artery. As you can see, the superior gluteal is passing between the lumbosacral trunk and S1. This inferior gluteal can either go between S1 and S2, or it's going between S2 and S3. I have those trunks to show you. And that is going to go into the gluteal region. Alright, okay? So what are the arteries we need to know here? We need to be able to recognize the obturator artery, this one. We need to be able to see superior gluteal, right? And the other one we need to try and see is this one. This is very important. This is the internal pudendal artery. That's going to go through the greater sciatic foramen, turn around, Going to go through the greater sciatic foramen, look at right here, turn around the sacrospinous ligament, which is right under here, and run back now in the lateral wall of the perineum, in the canal, in the pudendal canal, also called the pudendal canal of Alcock. So you need to concentrate on this artery here, which is the obturator artery. You can see that easily. This superior vesicle you can see fairly easily. And none of these you can really see well, but you should know that the uterine artery is crossing the ureter anteriorly. Alright? So, I'm going to show you what the internal pudendal does. It's going to go through the greater sciatic foramen right here. Alright? Then it's going to turn around the greater sciatic foramen, right around the ischial spine, right here. And then it's going to run back now in the perineum, right? In a canal that lies, remember the obturator internus muscle arises here, and it's going to go through the lesser sciatic foramen. Well, the artery is going to come back now, coming out, and then going back in. This time it's going to the perineum. It's going to run in a canal that runs from the yeah, there we go. Sorry. Okay. From the ischial spine, right along above the ischial tuberosity, right here to the inferior aspect of the issue pubic ramus. Just remember that root. There's not too many things you have to remember here. But you have to remember that the internal pudendal comes out, not just the artery, but the arterial nerve comes out through the greater sciatic foramen, turns around the sacrospinous ligament, and goes back into the lesser sciatic foramen, but is passing now, right, okay, in the perineum. Right here. That's where the pudendal canal is. Right? That's why when the gynecologist wants to do a pudendal nerve block, but the nerve and artery go together, they put their fingers in the vagina and they feel for this ischial spine. Right here, sorry. Right here. That's where they give the patient the anesthetic for the pudendal nerve. The pudendal nerve, the pudendal nerve is the nerve of the perineum. Right, we're going to come to that. We're going to talk more about that. And the internal pudendal artery is the artery of the perineum. Right? So, I'm going to go through some specimens and show you what I can, and then we go to the nerves. Let's just go over the 12 branches. The internal iliac has a short posterior trunk which has 3 parietal, that means body wall branches. Iliolumbar, lateral sacral, and superior gluteal. It has a longer anterior trunk. And how I remember the branches is that 3 branches are involved with the bladder. The superior vesicle is this one, right? It's coming off. And this here is the fetal umbilical artery, which, as you know, this part is contracted and forms a ligament which runs on the anterior abdominal wall. Everybody should remember the ligament that comes off of the bladder here that goes onto the anterior abdominal wall. That's the median umbilical ligament, going up to the umbilicus. Similarly, this contracted part, or should I say, ligamentous part really is this complete obliterated part of the fetal umbilical artery, right, is going to become the medial umbilical ligament. Medial. Right, so one is median and two medial. Superior vesicle is the patent part of the fetal umbilical artery going to the bladder. And this big artery here, right, is the pudendal, and these are ovarian. This is uterine, this is ovarian, and these are uterine vaginal. Uteral vaginal. Uteral vaginal. Right, I have to talk about the ovarian artery separately. All right, okay. All right. And this here is this is the middle rectal here. So three to the bladder, 3 to the viscera, uterine, vaginal, middle rectal, 3 to the body wall, and they are the inferior, gluteal, pudendal, internal pudendal artery, and the obturator. Alright? So let us look and see what we can see, and then we're going to go to the nerves. Okay, we're going to look first at a female pelvis. Alright, okay? And here, the side view of the pelvis. That's very good. Better like that. So, this is the bladder. Everybody can see the bladder here. This is the uterus, which is usually anteverted and anteflexed. Right? This. Right? So, uterus like that. Right, okay? This pouch would be the vesico-uterine pouch. Vesico-uterine pouch. This pouch here, a peritoneum, would be the vesico-uterine pouch. And we can see actually, if we look in this uterus, we're seeing these two little, go right down there for me. Two little nodules, one here, right? Lumps, one here. Another one here. Those are small fibroids. Sometimes they get very, very large. Okay. This is an elderly female, so the uterus is very small. Right. Okay. Right. Okay. And, so this is the bladder, and this is the utero-vesical pouch anteriorly. This is the usual position of the uterus. It's anteverted at this point. This is the vagina here, by the way. That's the vagina. This is the cervix you see in here. Anterior fornix, posterior fornix. Alright, so that's the vagina there. And you can actually see the ureter coming down here, right, in the wall. It really runs almost in the anterior wall of the vagina. So there's the ureter right here, right, coming down from the bladder. Alright, okay. Now, this pouch back here that we're seeing, this is this bit of sigmoid up here and rectum coming down here, right? So this now is the pouch of Douglas, right here. We put that like that, that's the pouch of Douglas. Everybody can see that pouch there? Let's make sure right here. Put it right there like that. That's the pouch of Douglas there. Right here? That's the pouch of Douglas. Right there. Get find out, yeah, okay, that's good. Pouch of Douglas. Sometimes the lady gets a collection in this pouch. The doctor passes the speculum. He wants to know where it is, what it is. So he goes right up in the posterior fornix. And they put a needle right through there, posterior fornix, into the peritoneal cavity. He knows there's no bowel there. He's going to aspirate and see. Sometimes if a woman is having low abdominal pain, and he suspects she has a topic and you don't know. Nowadays, ultrasound and all those things and CT scans and all those things have really made procedures like this a little bit obsolete. But still, sometimes you want to aspirate to see what type of fluid is it. Is it blood? Is it pus? Right? And you just put a needle in there. It's called a coldo, C-U-L-D-O, centesis. Right there. So you'll be hearing much more about that at the hospital. Right here. Okay? Now, we come on the posterior side of the uterus now. All we're seeing here, all we're seeing right here, all of this, my fingers in here, that's the broad ligament. So from the uterus, the peritoneum covering the uterus, right, okay, right, it's going to come away like this and form two folds right here, right, and that's the broad ligament. There are many parts to the broad ligament. If we look here, we can see the fimbrium. Everybody can see the fimbrium there? That's the fimbrium. You can see the fimbrium? You can go right down on that for me. Right, this one. Look at that. Those are the fimbrium. And we have a fimbrium, one fimbrium, that runs from that goes right down to the ovary. This ovary is, as I say, is the elderly lady. Right, okay? So this is the ovary here. So this is this fimbrium here, which keeps the infundibulum. Right? Remember, you have you have four parts to the tube. This is the tube here. So you have the intramural part here. Then we have the isthmus. Then we have the ampulla, which is the dilatation, and the trumpet here, right, which is the trumpet end here, right, this is the trumpet end here, which is the infundibulum, right, okay? So, you can see this fimbrium going right down to the ovary, and that sort of keeps this infundibulum right there. So when an egg ovum comes off of the surface here, it can be wafted easily into the infundibulum. And here, this is where fertilization occurs, right? In this widened part of the tube, which is called the ampulla. So that's the apex, the top part of the broad ligament, right? Okay, and this part here, that you can see through there almost. Let me show you. See through it there. That is the mesosalpinx. This is the mesosalpinx. That area, that hole, right? See, what you have to think of the broad ligament is the double layer peritoneum, but there are other double layers that come off of it. So we're on the posterior side now. That's the anterior side. Broad ligament, that's the posterior side. So here is the fimbria ovarica. Now, if we look at the upper end here, right, we see some vessels coming into this area, there, right, these vessels here. And these vessels that are coming in up here are coming from the posterior abdominal wall where the ovary originated. The ovary is going to be pulled down to this point by an embryonic structure called the gubernaculum. Same thing that pulls down the testis, not the ovary. So it's going to bring its blood supply with it, and this is the blood supply up here. It's going to come off from the aorta, and this is the suspensory ligament of the ovary. So this is the ovary. The ovary here, and this is the suspensory ligament of the ovary. We come to the inferior part of the ovary now. You see a ligament from here, from the lower part of the ovary to the cornea of the uterus, and that's the ovarian ligament. Right? So you have a suspensory ligament of the ovary, you have an ovarian ligament of the ovary. Now, this is the remnant of the gubernaculum. The gubernaculum pulled the ovary down to the posterior aspect of the broad ligament here, right? And then it got attached to the cornea of the uterus. Then on the anterior layer now, it have gone, but right about here, we have another double layer of peritoneum, which is going to go towards the deep inguinal ring, and anteriorly now we're going to have the wrong ligament. So the wrong ligament is the lower part of the gubernaculum, right here. It was much more obvious earlier, but it's pulled away the peritoneum, and that's why. Right? So the wrong ligament is on the anterior part, the broad ligament. The ovarian ligament, or true ovarian ligament, is on the posterior part. That's it right here. Let's see if we can show it to you properly again. Right on there, show them one thing. Alright, so this, what I have in the forceps here is the fimbria. Right? This, what's here is the ovary. This is the ovarian tube there, in the mesosalpinx. And then this is the ovarian ligament here. And then on the anterior, coming from the cornea to the deep inguinal ring, is the wrong ligament. Alright? Okay, so let me just see what I can show you here in the female pelvis. What I'm going to do is take out this pin. Right? So remember that the ovarian artery comes from the abdominal aorta. That doesn't come from down in the... Right, so if I take this away here, right now, right, you think you can just go right down in there, right down. So what I've done is pulled away they take away the peritoneum now, right, okay? It's a broad ligament, and the peritoneum is the side wall of the pelvis. So now we're looking at the, you can just one right down in here. Okay, so here is the obturator nerve, and here is the obturator artery. Those are two things you can see easily. You run along the lateral wall of the pelvis right here. Obturator nerve, obturator artery. Alright? Come back here now. We'll see this here is the external iliac artery, and this is the internal iliac artery on the right side. Going down. Alright? And this is the ureter. The ureter is coming down here. Alright? So if we come right down, and I really wish I could show it to you, but I can show it to you, but it's really difficult to see. The ovarian artery, the uterine artery is going to cross anterior. Difficult to show it to you already. And nobody is going to, you're not going to see any pictures like that, but the uterine artery is going to cross the ureter anteriorly, right, to get into the uterus. Just lateral to the cervix, right about here. Right about this point. Sorry, right about this point here. Lateral to the cervix. Alright? Now, let's look at the bladder and see if we see any arteries. And here we see an artery going to the bladder here. And this is most likely the superior. Sorry. Most likely here, superior. This one right down here. That is the superior vesical artery. So if you see anything going towards the bladder like this here, that's the superior vesical artery right there. So as I say, you're not going to see too many of these things, right, in the exams. Right, okay? Just remember the ones you can see, the obturator, right, okay, and the superior vesical, those are ones you can be asked about. Alright? Okay. So I'm going to move from this specimen, right, And to go over it again, let's just go over it one last time and just show you how much time is done. 1 hour, okay, right. So remember, this is a very important part right here. You can just see it, right? Right, here again is the upper part of the broad ligaments, that's the mesosalpinx. Here we see the fimbrium of the tube, of the ovarian tube leading into the infundibulum. Right about this point here will be the ampulla. Right, this is the fimbriovarica. That's the ovary. Right, okay. And here we have the ligament that's going from the inferior aspect of the ovary to the cornu of the uterus, right here, cornu. That's the ovarian ligament. And that ligament is going to continue on the anterior wall, on the anterior layer, in the anterior layer of the broad ligament as the wrong ligament. Right? Okay, so I think that's quite enough for you there. Right? Female. Let's go to the male now and see what we can find. So if we're preparing for your exams, you're going to be getting, you're a little bit lucky, I think, in that you're going to be just getting pictures of specimens. Alright, okay? Some of you would probably prefer to actually see the specimens, but we try to make them fair, right? Seriously, we're not here to be unfair at all. So, you've seen a sagittal section of a female, and you should be able to identify the bladder, the vesico-uterine pouch anteriorly, and the pouch of Douglas, which is the recto-uterine pouch posteriorly. Right? In the male, you just have one pouch, really. And that's the pouch between this bit here, which is really come away. Right here, this is sigmoid really, right? Rectum is right here, and the bladder. So let's see if we can find a little bit of the mucosa there. You look there, a little bit of it here. So that would be the recto-uterine pouch. Rectovesical pouch. Rectovesical pouch. Alright, okay? Only one pouch you find in the male. Alright? Now, this is the bladder. Right? Alright, okay? Here we have the kidney. Right, and we can see this kidney has a nice little hump right here, right, okay, or the dromedary hump, right here on the left side. That dromedary hump is because the spleen developed right in this region right here. Right, then we see the structures of the hilum, going through the hilum, renal vein, left renal vein, artery will be behind that, and posteriorly would be the ureter-pelvic junction. Alright, okay? Here we have the ureter running down. Remember, the ureter is the most posterior structure on the posterior abdominal wall. Right? In front of it, you'll find the testicular artery and vein running down. Right? So this is the testicular artery and vein, which is coming from what you can see. Let's get down here for me, right down here. That's this. This is the deep, right here. This is the deep inguinal ring here. So this is the testicular artery and vein coming up. Right? Okay, so they're crossing the ureter. Right? Very interesting on this patient here. Right? He has a very nice genitofemoral nerve. This is the source. This is the source major here. And this is the genitofemoral nerve running down with the source major. Right? And as we get here, the genitofemoral nerve is going to divide into a genital branch, which is going to go in, to the deep inguinal ring here, and a femoral branch right here, which is going to run down in front of the external iliac artery, and then the femoral artery, and then it's going to supply the skin below the inguinal ligament. This is the genitofemoral nerve here, right? And that is, I'm not doing the lumbar plexus today, but that is L1, L2. Alright, okay? Alright? So, let's see what else we can find inside here. Right? Beautiful, beautiful. Easy to find. Right? It's the obturator nerve. Right, okay? And the obturator artery. Right? You see them on the side wall going right into this area right here. Right? And this is the obturator foramen. The obturator internus must be looking at there. Obturator foramen. Right? Obturator foramen. Right? You see another vessel coming here, which we'll be talking about. Okay, but I don't want to go there yet. So the obturator nerve and artery is easy to spot. Right? Now, if we look, coming from the, if I can just put some more light in the picture there. Okay, here we had, this is the so if we look, this is the testicular artery and vein. What's coming out of here now is the vas deferens, or ductus deferens. The ductus deferens is going to run down on the side wall of the pelvis here, right? Crossing, right? The external iliac artery, external iliac vein, and the obturator nerve and artery and vein right there. And then if you look at this ureter, we'll see that the ductus deferens is crossing the ureter anteriorly, right? So coming from the side wall and crossing the ureter anteriorly. So remember that in the female, the ureter has one thing you have to worry about anteriorly in the female. That's the uterine artery. And the male, you have to think that the only significant anterior relation really right here is the vas deferens or ductus deferens. Alright? So I think we've seen enough from the side wall there. Now we can come back to this position and see if we can see these structures a little better. Right, so I put some pins in the prostate gland. Before we get to the prostate, I'd like to show you this little area of the posterior wall of the bladder. This is the mucosa of the bladder here. Right, and if we look here, you can see that hole, and that's the opening of the ureter. So this is the ureter that we just saw coming back there. Right, this one, right, sorry, this one, ureter, right, opening right here at the edge of a triangular area, when the half of the triangle is in here, called the trigone. This is the trigone of the bladder. So we can see that opening there, very nice, that's the ureteric orifice. There's a fold right here. At this point, the ureter runs just under the mucosa, right? It's going to penetrate through the muscle of the bladder, but as it gets to its opening, it's going to run for about 1.52 centimeters under the mucosa. That's called the ureteric fold, right there. Because there's no sphincter in the ureter, at the vesico-ureteric junction, what happens is that as the volume of urine in the bladder increases, then it's going to press on that ureteric fold, and that's what's going to prevent ureteric reflux. Reflux of urine from the bladder into the ureter. Very important arrangement right there. Called the ureteric fold. From the fold, we see a bar coming across here. That's going to come to the one on the other side. That will be the interureteric bar of Mercer. Interureteric bar of Mercer. Then there's another bar running down from here. You can barely see it. To the ureteric orifice, and this is the orifice of the ureter. This is the ureter right here now. This is the ureteric orifice. Alright, okay? That fold on the trigone there between the ureteric opening and the urethral opening is called the uretero-urethral bar of Bell. Bell's bar. And this is called the interureteric bar, interureteric because it's between the two orifices, the one on the one side and one on the other. That's called the interureteric bar of Mercer. Anyhow, that's for people who are very interested. Alright? Now, you can see the ureter going in here, and it's going to be entering. What you see in here is the bulb of the penis. This is the penis back here. All the way back here, right, okay? Right, so this is the bulb of the penis. Don't have much time to talk about that today, so I can leave that alone. But I want to show you the structures at the back. After the ureter crosses, after the vas deferens crosses the ureter, it dilates here to become the ampulla of the vas. Ampulla of the vas deferens. The ampulla of the vas deferens. And then, if we look behind now, and it's getting in the way. Oh, we can see it lovely here. You can see this other one here now, going up there. That's a seminal vesicle. So the back of the bladder now, medial, right, okay, this ampulla is medial to the ureter, right, okay, but the seminal vesicle goes even more laterally. Seminal vesicle is a part of it, there's more of it going back there, right, okay, the seminal vesicle. Two of them, ampulla and the duct of the seminal vesicle right here. If I were to press these, I want you to look at this point right here. Look at this little point right here. Right here. And there you can see fluid coming through there. And that's the ejaculatory duct. Ejaculatory duct coming right there. Right? This ejaculatory duct is going to run through the prostate. Right, okay? Empty into the prostatic urethra. Right? So, we're going to divide up the prostate into three areas. The part around the prostatic urethra, that's called the transitional zone. This area is called the transitional zone. And when you get the pathological problem you get here is hyperplasia of the prostatic glands. Remember, this prostate has a fibromuscular stroma with lots of glands in it. And you get this enlargement of the glands here, and you start getting benign prostatic hyperplasia. What will happen also is that this area here will enlarge. This area is called the uvula, right here, the uvula. Right? It's in the middle of the trigone. And that will enlarge and act as a sort of ball valve and sometimes block the urine going into the ureter. Alright? The area in white, so that's area in blue. So in the exam you can get a pin here, right? Pin here and a pin here, right? The area around the ejaculatory duct is called the central zone. Very little happens there. But this area back here, this area back here is the danger area. This whole area back here, right? A whole area back here. That's the peripheral or posterior zone, right along here. That's the area for carcinoma, or cancer. So you have there are 4 zones of the prostate. You have the transitional zone, you have the area around the ejaculatory duct, which is called the central zone. Nothing much happens there. Here you can get benign enlargement, but here is where you get cancer development. Alright, okay? Now there's another zone in the front of the ureter called the anterior fibromuscular stroma or substance. Right? Either one. Okay? Well, I just want to talk now about how much time we have left. We're going to come to the nerves now. Alright, okay? So the abdominal part of the femoral nerve. But here we have one nerve entering the pelvis from the medial aspect of the source. So this is a lumbar plexus nerve. This is the obturator nerve. Going to the obturator foramen right here. Alright? This is the femoral nerve. I'm not here to teach you the posterior abdominal wall and the lumbosacral plexus today, but I'm just going to be dealing with the pelvis. This is the femoral nerve, the obturator nerve. Now they have the same nerve roots, L2, 3, 4. Which is the anterior division, which is the posterior division? Alright? Well, don't really ask you that, but you should know that if you think back to the brachial plexus, posterior division, you rise to the radial nerve mainly, which supplies the extensors. The anterior divisions of the brachial plexus give rise to the medial nerve, ulnar nerve, right, okay, and musculocutaneous nerve, which supply the flexor divisions. Remember that the femoral nerve is going to supply mainly the quadriceps, which are extensors. So right away, you should know that the extensors, this is the posterior division, whereby the obturator nerve, which is just passing through here, right, is going to supply the adductor muscles, which are really like modified flexors, alright, okay? So this is the posterior division, anterior division. Anterior division, posterior division, L2, 3, 4. We're not here to talk about that. I'm here to show you 3 things that cross the ala of the sacrum. So, the ala of the sacrum, yeah, okay, right? We're going to have 3 nerves crossing. Alright? The one medially is going to be the sympathetic chain. The next one is going to be the lumbosacral trunk, right, okay, coming down, right, okay, from the abdomen. Remember that the lumbar plexus is L1, 2, 3, 4. Part of 4 goes into the lumbar plexus to form these 2 nerves, L2, 3, 4. Another part, sorry, L2, 3, 4. Alright? So those are lumbar plexus nerves. Now the sacral plexus is formed by this trunk here, which is the lumbosacral trunk. So it's a part of L4 plus S1. The part of L4 plus S1 is the lumbosacral trunk. So that's part of the sacral plexus. Right? The rest of the sacral plexus is S1, S2, S1, S2, S3, and S4. Right? So here we see in the obturator nerve. This is the lumbosacral trunk. Right? That's L4 and L5. Now this is the trunk that comes in the practical exam more than anything else because it's hard to see these. They are formed anteriorly to the piriformis muscle and they lie behind a fascia on the piriformis muscle. It's really hard to see them, to dissect them out. Just like the lumbar plexus, it's hard to see the roots and divisions of the lumbar plexus because they are in the source muscle. So similarly here, it's hard to see them. Right? But you can see this one easily, so it's the lumbosacral plexus. Now the third thing that crosses the ala is the sympathetic chain, which is right here. Right? Sympathetic chain. You can see the sympathetic ganglia there, right, in the sympathetic chain. And I can show you that. Right, so remember the ala, three things. The medial one is the sympathetic chain. Next one is the lumbosacral trunk, and the following one is the next one is the obturator nerve. So let's see if we can see them in this picture now. So that's one. Okay. That's two. That's three. That's four. Right. This right here is the sympathetic chain. Right. So these are sympathetic ganglia you see in there. Three things cross down. So how are we going to know the branches of the lumbar plexus? Right? All you're going to see is a mass of nerve roots, right? Okay? S1, S2, S1, S2, S3, S4. Right? Okay? Right? The S1 joins here, is S2. They are headed with this big nerve down here, which is the sciatic nerve. Right? That's the sciatic nerve going on there. How do we know the branches? So let's look at them. We have L4, L5, S1, S2, S3, and S4. Right? Now, if we were to box them in boxes of 3 initially, we will find that these 3 here, L4, L5, S1, will give rise to the superior gluteal nerve, and to nerves that have the same nerve root, which is the nerve to obturator internus and inferior gemellus. Oh, sorry. Quadratus femoris. Sorry about that, guys. Quadratus femoris and obturator and inferior gemellus. All right. The free box. L5 Instead of drawing a circle this time, I put a box, which is really what I usually do. L5, S1, S2. That's going to give the nerve that supplies the gluteus maximus, which is the inferior gluteal nerve. And then the nerve to superior gemellus, well let's put the obturator internus. And superior gemellus. All these are gluteal, are muscles in the gluteal region. That's the superior gemellus. Okay. Now, if we were to take S1, S2, S3, right? This is going to give you the nerve. This is the posterior femoral cutaneous nerve. This is the important one here. Put it in green. This is the pudendal nerve. The pudendal nerve. This is the one you need to know. You need to know this because this is the nerve of the perineum. This is the nerve of the perineum. Just like the internal pudendal artery is the artery of the perineum. This is the nerve of the perineum. Then, if we just put everything here now, L4, L5, S1, S2, S3, one more box, that's the sciatic nerve. But remember, the sciatic nerve has two parts. It has the common peroneal, and it has the tibial nerve. And they have the same nerve roots except common peroneal has one root less. Common peroneal is L4, L5, S1, S2, and the tibial is L4, L5, S1, S2, S3. Then you have to know which one is anterior root and which one is posterior root. But you remember the common peroneal is extends the foot, which we call dorsiflexion, by the way. Right? Then that is going to be posterior root. And the tibial nerve, right, which flexes the ankle, right, okay, right, is the anterior divisions. You can work them out here, all right, okay. What I'm interested in here today is this I'm going to talk a lot about. Oh yes, we have a couple other. So those are the ones that leave. They all are heading towards the sciatic foramen, and they're going to come out on either side of the piriformis. We'll talk about the pudendal in a little while. But there are a couple other branches that supply from the roots, like S2, 3, and 4, right? S2 and 3, and 4 also, would supply the levator ani, right? Okay? And there's another nerve called the perforated cutaneous, which is S2 and 3, but I wouldn't go into that right now. I want to talk about the internal pudendal. Let's see if we can see it. All right? So, I have it right here for you. Remember, just like the artery is going to come through the greater sciatic foramen, right, which is here, and then it's going to come back in through the lesser sciatic foramen and then run in this canal. And this canal here, you can see nerve, vein, artery, and vein. Right? right? So this here that I've opened up here for you, that is the pudendal canal. The pudendal canal of Alcock, right? So it has the pudendal nerve in it here, artery and vein, right? They are running the pudendal canal on the obturator internus muscle, but below the levator ani, and these are the levator ani muscle, the iliococcygeus part of the levator ani muscle, which is coming down off of the obturator fascia. This is the this is running these structures, which is the internal pudendal artery, pudendal nerve, and internal pudendal vein. They are running in the canal of Alcock, right? Okay, coming from the ischial spine right here to the inferior part of the suprapubic of the inferior part of the ischiopubic ramus. So there's ischiopubic ramus here. Right, okay? Right. Yeah. Right, okay? So it's coming here. Right, okay? And at this point now, we're going to take the nerve first and then the artery and show you what happens. Alright? I've taken up a lot of your time already. Alright, but you have to know these structures. You have to know this nerve, and you have to know the internal pudendal artery. Arteries and nerves have the similar names. Right? So what I tell you for the nerve is what you're going to hear about for the artery. So this is the ischiopubic ramus would be right here. Right, okay? Here we have the vagina. Here we have the anus. The anus. So this part in front here is the urogenital triangle. This part behind here is the anal triangle. This nerve is coming here now. It's running right here, right? That's in the lateral wall of the ischiorectal fossa. Lateral wall of the ischiorectal fossa, right? We're further back here, right? Okay, right? Okay, and then it's going to come now, and then it's going to enter back here, right? Okay, then it's going to come and enter now the UG triangle. So as it comes out, right, it's split in. Here is given branches to the sphincter externus, right? Okay, of the anal canal, and these are the inferior rectal nerves. Inferior rectal nerves. Inferior rectal nerves. Then it's going to continue forward now, and it's going to give the inferior rectal nerve and inferior rectal artery. Just imagine the internal pudendal artery doing the same thing, right? Same branches, right? It's given the inferior rectal artery, which is going to go to the anal canal. Now that these branches coming here, right? We can say there are two nerves, two named nerves, but many branches of one. One is the perennial branch, and the other one going all the way up here, right? That's the dorsal nerve of penis or dorsal nerve of clitoris. In this case, is the clitoris up here, so that's the dorsal nerve of clitoris. Very important nerve, very sensitive area. Right? Similarly, that nerve is going to go into the penis and become the dorsal nerve of penis. Right? Similarly, an artery, right, is going to become the dorsal artery of the penis. Right? Okay? Right? Then you have other branches going to the penis, right? Okay, right. You have the cavernous cell branch, which is the deep branch, and you also have the bulbourethral branches. But similar arrangements. They go to the structures. So we're talking about the nerves now. These are the perennial nerves. These are the perennial branches here. These are those. So they are going to supply right here, for example. This part is the superficial perennial pouch, and here is the deep perennial pouch. This is the perennial membrane here. So this showing you here, going into the deep perennial pouch are the deep perennial branches, right? Okay, and you have some superficial perennial branches on the outside. Some of those superficial perennial branches, like the posterior scrotal nerves, are going to supply the posterior part of the scrotum. here they're going to supply the posterior 2/3 of the vulva. Alright, okay? But the deep perineal nerve here will also supply the lower half of the vagina. Alright, remember the lower half of the vagina is very has good sensation, whereby the upper half just really there's much sensation there that responds more to distension. So just think of alright, so just remember those when you read, and just remember this canal. Always remember, see, I can't show you all the nerves, alright, okay? But I can show you that S2, 3, 4, right, it will be this one, and this one. I'm going to give you a nerve called the pudendal nerve, which is going to come through here, through the greater sciatic foramen, come back in through the lesser sciatic foramen, right, okay, and then run along. It's going to come here, alright, at the ischial spine, alright, come around the ischial spine, run right along here, and that's where you'll find the pudendal canal of Alcock right here, alright. So if we just to do a little recap on what I've just said, we have the internal iliac artery giving you these 9 branches from the long anterior division, 3 branches from the short posterior division. Right, and here we have the sacral plexus giving you a lot of branches here, right? But the important branch that you really need to know here is the nerves to the piriformis muscle and the nerve to obturator internus, and also the pudendal nerve. Right? Pudendal nerve is very important. But I'm going to mention a plexus which we see right here. This is the inferior sacral plexus. Right? Remember that all these structures in the pelvis have autonomic innervation. So here is the inferior hypogastric plexus. Inferior hypogastric plexus. Right? What we're seeing right here. That's going to get, right, parasympathetic nerves coming into it like here. It's coming from S2, right? Look like S3 here, because this is S1, S2, S3, right? And this is a branch here of a pelvic splanchnic nerve. When we talk about the pelvic splanchnics, we talk about parasympathetic innervation coming from the sacral outflow of the parasympathetic system, S2, 3, 4. Very important. Those are preganglionic branches, and they don't synapse in this plexus at all. They synapse in postganglionic neurons on the organs, bladder, uterus, cervix, and vagina, those areas, right? Okay? Rectum. Right? So that's it, parasympathetic. Sympathetic comes into this plexus, inferior hypogastric plexus, in 2 ways. They are coming from between T12, L1, L2. That is the distal part of the lateral horn, right? Where the preganglionic sympathetic neurons are. Some run through the lumbar splanchnics, and then they go to the superior hypogastric plexus, and they run down through 2 nerves behind the rectum called the hypogastric nerves, right, to this plexus. Others are coming in from sympathetic splanchnics, from sacral splanchnics. Don't mix up sacral splanchnics with pelvic splanchnics. Pelvic splanchnics, when we use the term pelvic splanchnics, we're talking about S2, 3, 4. Sacral splanchnics are coming off of the sympathetic ganglia in the sacrum, but their preganglionic fibers are up in T12, L1, L2. Alright? So don't forget this inferior hypogastric plexus. That's giving you very important information to the bladder for micturition, uterus, right, okay, and the rectum, internal sphincter of the rectum. All right, so that's the innervation and the blood supply. All right, that's a lot in 2 hours. It's just something for you to read up about, right? And also, I've gotten a chance to show you what a male sagittal pelvis looks like and a female sagittal pelvis looks like. I wish you all very good luck in your studies, and hope we get to see each other again soon. Thank you.